Whether you are a formal clergy or staff member, or a volunteer, your leadership in your faith, religious, or spiritual community means you probably wear many different hats. And you may be wondering how ACEs fit into your already overloaded job description. Adverse childhood experiences, or ACEs, affect all of us. Fortunately, ACEs can be prevented, and you play a vital role in creating an environment and fellowship that supports prevention. Throughout this training, you'll hear stories from your peers. These ACEs torchbearers are faith, spiritual, and religious leaders who have shared their personal experiences and learnings related to adverse childhood experiences, or ACEs, and opportunities for prevention and healing.
Children who are involved in faith, spiritual, and religious communities have many avenues for support via clergy, teachers, and youth leaders.
ACEs have deeply impacted my community of faith. There are countless people living in Trenton, New Jersey, who are not aware of how their deep adversities suffered in childhood are now affecting them as young and middle-aged adults.
It's important to extend support to adults who had ACEs as children. I recall a parishioner who experienced a lot of childhood trauma. He had many ACEs. He spent most of his childhood in foster care and was adopted by an abusive family. He then suffered a traumatic brain injury while serving in the Army. He was brought to our church by another veteran with a similar background. He has been welcomed by the church, given rides, encouraged in his job searches, and visited when he's been admitted to the hospital. Our community is here for him to celebrate successes and offer a hand when he is in need.
Kids raised here saw their refugee parents struggle as immigrants with a lack of language and carrying a lot of trauma from their home countries. Our community not only helps Syrian refugees heal from intergenerational trauma, but we provide job training and social services. As a community, we do the work, not always realizing that it's lessening the trauma on the children and the family. What I want others to know is that how you lend a hand and how you approach that person can make a bigger difference than you know at the time.
I want every religious leader to know that they don't have to reinvent the wheel. Every April is Child Abuse Prevention Month. May is Foster Care Awareness Month. October is Domestic Violence Awareness Month. And November is Adoption Awareness Month. Pastor, imam, rabbi, father, priest. During those 4 months, invite someone in to partner with you and help raise awareness about these important topics and issues and what we can do to prevent them. The best way to prevent ACEs is to implement strategies that work, to support families and children with the resources they need before they get into crisis.
You just heard from leaders of various faith traditions about how their communities are welcoming and helping people who've experienced childhood adversity and trauma, and how we can support families to prevent ACEs in the first place. Throughout this training, you will continue to hear from these faith, spiritual, and religious leaders, our ACEs torchbearers. You may see yourself in these firsthand stories from your peers. You may even be doing the work without fully realizing how deeply adverse childhood experiences have shaped the children and families you serve, and how members of your community can play a critical role in prevention. That's where this course comes in. You will learn what ACEs are, how they impact both kids and adults, and how all members of all faith, spiritual, and religious communities can prevent ACEs. We will also teach you strategies to enhance the work you're already doing to provide safe, stable, and nurturing relationships and improve the health and well-being of people who have experienced ACEs.